That's right. You could win $1 million, and you might already be entered. Anybody who got the vaccine in Colorado or who gets the vaccine will be an automatic participant in not one, not two, not three, not four, but 5 drawings for $1 million, a total of $5 million that will be given away to people who have received the life-saving vaccine in Colorado. Coloradans are powering the comeback every day by being vaccinated. And to help get us over the hump, we're launching Comeback Cash. This is with money that otherwise would have gone towards advertising and marketing. We are doing a drawing to make sure it goes right to you. Everybody who has already gotten vaccinated can be part of this drawing, already is entered in the drawing. If you get it in the next few days, you'll be part of it too. We're going to draw the first winner and have it announced Friday, June 4th. And you'll need to get the vaccine by June 1st to make sure you're part of that first drawing for the June 4th giveaway. If you miss that date, you will still be part of the subsequent drawings on the next 4 weeks over time to make sure that that you have a chance to win $1 million. 5 Coloradans will be walking away with $1 million giveaway, comeback cash, that you can use on whatever you like, simply by taking the sensible step of being vaccinated like I have, like my friends and family have, like my parents have, and like so many Coloradans already have, well over 50%. I'm proud to be joined by the Colorado Department of Revenue Deputy Director Mark Ferrandino, CDPHE Immunization Branch Chief Heather Roth, and Jennifer Anderson from the Colorado Lottery, which is powering Colorado Comeback Cash. Right now, 58.5% of Coloradans have gotten their first dose, and 51.5% have been fully vaccinated. We have seen this kind of drawing work in states like Ohio, where they saw a surge in interest from launching their drawing, and we expect that we'll see the same thing here. All you have to do to enter is get vaccinated. And whether you've been vaccinated once or twice, Moderna, Pfizer, Johnson & Johnson, everybody has that chance of winning this lottery. We are thrilled to be able to put $5 million towards this. We feel a lot of a bigger impact on driving vaccination than if we were running TV ads saying to get vaccinated. And best of all, the benefit goes to 5 lucky Coloradans who did the right thing and protected themselves. Ohio saw a big increase of 16 and 17-year-olds, and this $1 million prize is for 18 and up. We will also be announcing the specifics on scholarship prizes for Coloradans aged 12 to 17. So we'll be announcing those specifics soon. But if you are 12 to 17 and you've got vaccinated, you're already in the pool. If you want to make sure you don't miss out on any opportunities to win, get vaccinated right away. Same with 18 and up, you're eligible today. If you've gotten vaccinated, you could win $1 million. And if you want to not miss out on any opportunities to win $1 million, get vaccinated by the end of May. You know what? The Colorado Lottery is an exciting partner in this, and many states are doing this. New York launched new lottery tickets. Maryland, Ohio, were based on the evidence and the increases in vaccinations. We believe this is going to have a similar effect here in making sure that people do the right thing and that you could be the one that wins $1 million. Eligibility criteria are simple. You need to be alive. You need to be a resident of Colorado. You need to be at least 18 years of age when you win it. You could have been 17 when you got vaccinated. You just need to be 18 when your name comes up and gotten at least your first dose of Pfizer or Moderna or your one and only dose of Johnson & Johnson. Our team at Higher Ed is also working on the scholarship piece, which we'll announce later this week or next week for exactly what 12 to 17-year-olds win. And I'm very excited to say that we're very close to 20% of 12 and 17-year-olds have gotten their first dose in our state. There's a few folks who are not eligible. If you are an administrator of the Colorado Immunization Information System or an auditor conducting the drawing, of course you're not eligible. Also, me and Diane Primavera are not eligible. Your governor and lieutenant governor are not eligible. But otherwise, this could be you. Opportunities to win big are coming every week. June 4th is the first drawing. June 11th is the second drawing. June 18th is the third drawing. June 25th is the fourth drawing. And the final drawing will be July 7th. To make sure that you have a chance in all of those drawings, get vaccinated now if you haven't already. For more information on Comeback Cash, visit coloradocomebackcash.com or lavacunadelmillon.com en español. And if you've been delaying plans to get vaccinated or still on the fence, now's the time to swing big. It could transform your life. This isn't like one of those lotteries where you get a little teeny bit for 30 years. This is $1 million cash on the barrel that you can use today. Buy a new home, take that vacation, take 6 months off, do whatever you like. $1 million goes a long way. You can sign up now, show up at a community vaccination site in your area, and you can visit cocovidvaccine.org to find one near you. 1-877-CO-VAC-CO. You can certainly take advantage of our state vaccination sites where you don't even have to get out of your car. Dick's Sporting Goods, Ball Arena, formerly known as Pepsi Center, Broadmoor World Arena, Colorado State Fairgrounds, but you can also go to your local pharmacy, hospital, community health clinic, or doctor. Most of these sites do not require appointments. Our state sites do not require appointments. You can come by anytime to get vaccinated during business hours. May the odds be forever in your favor, Colorado. Every vaccine works incredibly well. So rather than gamble on getting COVID, let's take a chance on winning $1 million. That's a good risk, not a bad risk. COVID vaccines are among the most effective ever developed in history. As the vaccine trial for Pfizer showed, it's 100% effective for 12 to 17, and 95% effective for 18 and up, but it's really even more effective than that because the people, that 5% that still get it, get much more minor cases of COVID, much lower level of hospitalization. So this is the final round. When we get vaccinated, we hit the jackpot. That was enough for me to get vaccinated, but if it's not enough for you, now you'll have a chance at winning $1 million, not once, not twice, not 3 times, not 4 times, but 5 times over the next few weeks. And we realize greater success than ever before. Everybody that gets vaccinated is a winner. Happy to take some questions. Actually, I'm going to do Spanish real quickly. Bienvenidos a todos. Hoy tengo un anuncio muy importante. Sabemos que muchos más residentes de Colorado planean vacunarse en algún momento, pero necesitan un incentivo para hacerlo una prioridad y buscar el tiempo para hacerlo. Por eso, me complace anunciar la vacuna del millón. Usted puede ganar $1 millón solamente para recibir la vacuna. Cada coloradense que ya esté vacunada o que se vacune antes del 30 de junio será elegible. No necesita ser ciudadano americano, solo necesita ser residente de Colorado y tener más de 18 años. Daremos $1 millón cada viernes de junio y el último el 7 de julio. Usted podría ser un millonario. Okay, questions?
What are the actual chances that you will win? Pretty good?
So we have just over 2.5 million people that have been vaccinated. We expect more. And so with 5 drawings, your odds are about 1 in 500,000 or so. These are very good odds. These are better odds than winning $1 million in any other type of contest that I've ever seen, better than the Powerball, better than any of those. There will be 5 winners from among all the Coloradans who have been vaccinated of this $1 million prize, and there'll be additional winners of scholarships in the 12 to 17 age group.
¿Usted cree que con esto, incentivo, la gente acuda a vacunarse, la que no está vacunada?
Las personas que ya son vacunados, ya están elegibles y ya están un parte de este anuncio. Usted puede ganar, pero también si no ya recibieron la vacuna, todavía tiene tiempo. Si lo recibieron antes del 30 de mayo, usted puede ganar en todas las oportunidades de ganar $1 millón.
Marshall?
Forgive me for some latitude here for a few questions. First of all, it's run by the Colorado Lottery. Is that why it says lottery?
In conjunction with CDPHE.
Are there alternatives? How can you restrict entry if I'm someone who does not get the
Sure, I'll let the lottery officials discuss that. Jennifer from Colorado Lottery.
Hi, Jennifer Anderson, Colorado Lottery. Could you please repeat the question?
How can you restrict entry? So if I choose for religious, health, or personal reasons not to get vaccinated, how can you restrict me from also having an opportunity to win?
Anyone will be permitted to decline the opportunity to be eligible to win the prize. So the drawing will occur by assigning random numbers to each person over 18 who is in the database. And we will do a drawing, all random and with a lot of security in place, to generate winning numbers. There will be one winning number and a series of alternates. We will then, CDPHE will contact you, and if you do not wish to be part of the drawing or to claim the prize, you have every right to decline to do so.
So I have to do nothing to enter. Besides, like if I'm vaccinated, it's a database that you have access to.
Yes, I'm sorry, I thought I was clear on this. Everybody who's been vaccinated is in this lottery. Doesn't mean you have to accept the $1 million, as Jennifer said, but you'd be pretty foolish not to. And I know that you're not foolish because you've already gotten vaccinated, and that shows a sign of wisdom in protecting yourself and your family. So everybody who has been vaccinated is part of the drawing. Everybody who will get vaccinated by the end of May will be part of the June 4th drawing. And then if you get vaccinated in early June, you're still part of those other drawings through July 7th. But to maximize your eligibility, get vaccinated by the end of May. And as she indicated with the process, Marshall, there is a random number assigned to each person who has received the vaccine. The lottery then chooses one random number that wins, along with potentially alternates if that person is deceased or is under 18. And then only that person's identity is looked up, and then that person is contacted and asked if they'd like to win the $1 million.
Governor, can you talk about where the $5 million is coming from for this, and how much, what percentage this represents of the broader vaccine uptake initiatives, and if you feel like the other ones aren't working and that your ROI will be better on this one as compared to the other ones?
Yeah, so this is, it's CARES Act money, and we always look at how we can use the money as best as we can to drive vaccination. So that's a combination of access, meaning our contracts for these large sites, it's advertising, it's the mobile bus, it's this. We feel this complements some of the advertising and outreach that we're doing, and will generate even more interest in the vaccine than if we simply had spent this money on television commercials.
John?
Governor, looking at other states, do you have a sense of how much this might bump up vaccinations as a percentage?
So many states are in the process of launching this now. The most mature is Ohio, and they saw a double-digit percentage increase, particularly prominent among younger Ohioans from the announcement of their lottery.
Governor, this is Deborah, Fox 31. A quick question about interest. I know you said that's why we're doing this, but how many people does the state hope to reach before the lotteries end? And I know there's probably not like an infinite pot of money, but will the state have more lotteries if that number isn't reached?
So we plan 5 giveaways of $1 million. The final giveaway is July 7th. If you want to have a chance in every one of those giveaways and drawings, please get vaccinated by the end of May, and you'll automatically be entered in all those drawings. If you don't make it till early June, you might be eligible for 3 or 4 of those. We think that most Coloradans want to do the right thing and get vaccinated. Our research shows there's probably only 10 or 15% that don't want to get vaccinated. But for the difference between the 58% who've gotten at least one dose and we get up to 80, 85% and people might not want it, there's a lot of people in between. It's just a matter of finding the time to do it. And this is an incentive to do it now because you'll have your name entered in the drawing for $1 million, and there's going to be 5 lucky Coloradans walking away with a life-changing gift of $1 million. The $1 million is, of course, subject to taxes, as everybody knows, but it is a lump sum payment, and you're responsible for the rest.
Governor, Jesús Carrasquel from Noticias Univisión Colorado. ¿Nos puede decir nuevamente si esta estrategia podría ayudar a que las personas se vacunen?
¿Otra vez? ¿Otra vez?
Gobernador, ¿podría decirnos si esta nueva estrategia ayudará a que las personas se vacunen?
Todas las personas que ya recibieron la vacuna son elegibles para ganar este $1 millón. Anunciaremos el primero de los 5 ganadores el próximo viernes 4 de junio con sorteos todos los viernes de junio. El último sorteo será el miércoles el 7 de julio. So I'm not sure I follow. Tell me again.
So how was the data collected to
Yeah.
ensure that everyone has a fair
Oh, at
opportunity?
CDPHE, did address that?
I'm Heather Roth with CDPHE. So all enrolled COVID vaccine providers have to report by law, really through what they signed with the CDC provider agreement, all of the doses that they give to the Colorado Immunization Information System. And along with those doses comes demographic information for the patients. So things like your address and your phone number, and even if your email address, if you give it to the healthcare provider. We have really good data quality in the system. We have phone numbers for 89% of the people in the system. So I feel good where we are in terms of data quality.
And again, all of the information will remain confidential. The only information that will be provided to the lottery will be the winner, the one winner. All of the others will be anonymized with a randomly assigned number. The lottery folks in the drawing will then choose one of those numbers. They will not be chosen by name, they'll be chosen by number. It'll only be matched up for the winner.
Governor Polis, this is Sarah Flower from KSUT Four Corners Public Radio. My question kind of piggybacks on the previous one and maybe goes to Jennifer. I'm curious, here in Southwest Colorado, several of our residents, both native and non-native, have been vaccinated by Indian Health Services, or IHS. I'm curious if those residents will be included in CDPHE's numbers.
Yeah, I can actually take that. This is Heather again. Yes, IHS tribal clinics report to CIS, so that data is in the system and those people are eligible.
You talked a little bit about the vaccine privacy, but a lot of folks are worried about their, private medical information being out there. It sounds like the state actually does have a decent amount of information on people who've been vaccinated. How can you tell folks that that information is private and secure and won't be released, given that now it's available to the Colorado Lottery?
So that's HIPAA protected, like any of your private medical information. Only the winner will be notified, and they will have the opportunity to choose whether they want the $1 million and to share. But the lottery commission will simply have a randomized number for each person. The state maintains a lot of HIPAA secure information, and there are very strong privacy and provisions for that. There's a lot of information far more sensitive than simply vaccination status. There's strong firewalls and good protections that we have under federal law in all 50 states with regard to personal medical information.
I have one nerd question and then one for Heather. My nerdy question is, I've done a research on lotteries versus sweepstakes, and lotteries require licenses. Does the state have a license to run this lottery?
So this is a drawing, and I'll have Mark Ferrandino might address that, or whoever, Jennifer? Yeah. It's called a drawing.
Jennifer Anderson, lottery. This is not a lottery. We operate under a constitutional exception to run a lottery, and it's a state-run lottery, and this drawing is completely outside of that. The only piece that the lottery is actually doing is generating the random numbers so that CDPHE can identify a winner. Beyond that, the lottery is not involved, and none of the prizes are coming out of lottery money or anything like that.
And the lottery is good at randomly selecting things. That's why they're involved. So we trust their ability to do that. They just get the number. They don't have the name. They just get the numbers from CDHE, the unique identifier numbers. One of them is randomly selected, and then the winner will be notified. Did you have a second question?
Yeah, just for Heather, and I know this is moot for this purpose, but for people who have a vaccination card that they've washed it, they've lost it, we've received complaints that it's been difficult to either talk with CDPHE about getting a replacement or going back to the provider to get a replacement. It doesn't sound like you'll need that physical proof for this purpose, but if you want it for any purpose, how do you get a replacement vaccination card?
Yeah, and I'll let her address how to get one. So the contents of the card are entered in the secure database, so you do not need the physical card to claim your $1 million. If you do want a new physical card,
So really our guidance is for them to go back to the vaccine provider that gave them their dose. And they can create a new card. We're kind of concerned about fraudulent cards out there, so it's not something that you can just print out and fill out. You want your healthcare provider to do it. That said, if you can't get a hold of your healthcare provider, you can call our department. We have a help desk staffed with a lot of people all around the CIS. So if you lost your record, you can also call us and we can print out a record and send it to you.
And that is a if you, there's often things like traveling overseas where you might need to show proof of vaccination, and if you left it in your pockets and it got destroyed in the wash, that would be an example of where you might need to show something if you're traveling to Europe or Asia or somewhere else. Thank you all, and may the odds be ever in your favor. I look forward to congratulating 5 lucky Coloradans on winning $1 million, and even more importantly, I look forward to helping to end this pandemic and save lives and return to normal as rapidly as possible. Thank you.